Good morning, friends. Welcome to my YouTube channel, Psychology for Change. I'm your Sandhya Gopalakrishnan. Today, I'm going to talk to you about attention deficit hyperactive disorder. In my previous video, I spoke about autism spectrum disorders. I hope it was useful for most of you, and thank you for all your valuable feedback and comments. I look forward to your feedback and comments for this video and all my future videos. So, attention deficit hyperactive disorder. Now, as the name suggests, this is one of the disorders of childhood, a neurodevelopmental disorder, a very commonly identified emotional and behavioral disorder that has been found to be treated among youth in the current scenario. This attention deficit hyperactive disorder, as the name suggests, is to deal with two important areas, especially the attention span of the kids and the activity level of the kids. So, we have many a time seen those kids around us who have been too super active in their environments, the kids who have not been able to focus on one task at a time, the kids who had kept shifting their interest or attention onto different objects at a very fast pace and all that. And these are the kids who have been found to be very difficult to be managed by the teachers in the classroom setup, the highly distracted kids, and who tend to distract the entire class environment. Also, the parents tend to report of these kids as ones who need many different activities at one go to keep themselves engaged. So, I think most of us would have had many instances where we see such kids, but sometimes we tend to misinterpret these kids as the ones who have been overly pampered or very flexibly nurtured kids who haven't been taught so much of discipline and all that, or any behavioral etiquette as such. But the fact is that it is not that these kids behave voluntarily in such ways. It is their wiring or their biological determinants which make them behave in such ways. So, even before we could conclude that a child is actually having a problem of attention deficit hyperactivity, we need to, of course, have a couple of signs and symptoms to be diagnosed based on certain criteria. As in, these signs and symptoms that we identify in these kids should have been prevalent for a time of at least 6 months or more. And also, these kids should have all these deficits and inattention problems and their hyperactive problems pervading all their different functioning areas, like their social setup, their home environment, their school environment, and the workplace, as or also if they are going to be in their adolescent or adulthood years. And another important criteria is that the conditions of their inattention and hyperactivity should not be the result of any other psychotic disorders or any other internalizing or externalizing disorder conditions which could be diagnosed in the kid. Uh, Moreover, these symptoms and signs should be also affecting their normal functioning in a way it is going to be incongruent to their developmental age. For example, if these kids were of about 10 years or 12 years of age, if they are going to exhibit symptoms of inattention and hyperactivity of the age of a 6 year or a 5-year-old kid, then of course they are more at a high risk of being detected with attention deficit hyperactive disorder. Now, when we talk about the real signs and symptoms of a kid with ADHD, of course, these are the kids who have problem in focusing their attention on one particular object at a time or one particular task at a time. Their mind keeps wavering. They shift their attention from one to the other very swiftly. And these are the kids who will not be able to pay attention to details of any task or any objects of attention. So they will not be able to finish any school activities assigned to them. They cannot work upon any instruction module that's been given to them. So also these children, they have problem with their learning areas, since attention goes hand in hand with their learning abilities. Also, they tend to have problem in the classroom setup and in the school settings where they need to exhibit a couple of their learning abilities. So when we talk about their hyperactivity signs and symptoms, then it is more about their motor responses and behavioral patterns. We could find these kids most of the time showing fidgeting responses. They are finding it so socially awkward to keep seated in one place for a longer period of time. They are the kids who are going to always do hand tapping or feet tapping behaviors. And these kids also cannot wait for their turn to respond to any particular situation. Maybe it's a question posted to them, or if it's going to be a particular activity that is involved and they need to wait for their turn to take their chance, they will not be able to do it. And these are the kids who will not be able to wait to answer anybody's question. They will try to blurt out their answers even before anyone questions them, and they mostly operate from their emotions and not so much on facts and figures. So they will not be able to see things around them, observe, assimilate information, and then draw conclusions and all. Of course, they cannot generate methodical solutions to any problems. They are more imaginative, they are so creative. So, they are the ones who bring about so many innovative solutions to many of the problems which were earlier found to be methodically solved. So that is one special ability of these kids with ADHD. Of course, because of their lack of control on their impulses and that sense of social etiquette, the lack of sense of social etiquette also, they tend to intrude into the private space of many other people who are around them in different areas, whether it's the work area, the social area, the school or home environment. They will not be able to of course, wait for the other people to complete their conversations. They may interfere with the conversations of others. They may also try meddling with the things and using the things of others without their permission. So, these are a part of their behavioral patterns, which could also lead to some conduct difficulties in later years. So, this is all about the diagnosis of this disorder, attention deficit hyperactive disorder. Now, when we think about the prevalence of this disorder, of course, it was found that 3 to 5% of the school-going population were identified to have attention deficit hyperactive disorder, and mostly the onset and incidence of this disorder happens before 12 years of age. Highly, it is evident during the 6 to 7 years period of childhood. Also, sometimes these signs and symptoms of these kids go unattended, that they become so predominantly manifested at the later adolescent or adulthood years. But research results have proved that the symptoms should have had their onset as early as 12 years of age. And when we talk about the prevalence, also boys were prone to be more running a risk of developing this disorder than girls. And the causes or the etiology, when we analyze, we find that there is a major component of inheritance involved. It was substantiated by the twin studies and most other genetical inferences, that it was found that monozygotic twins were at a higher risk than the dizygotic twins, and also the siblings or other relatives of these children with ADHD had a higher risk of developing the disorder. Also, mothers who had ADHD symptoms and signs tended or were vulnerable to give birth to children with ADHD symptoms. It was also found like various other factors like the prenatal, perinatal, and postnatal conditions of the mother and the relationship of the mother with the child biologically. Also, if there had been complications in that, if there had been a brain injury involved during the childbirth, the exposure of the mother or the neonate or the fetus inside the womb to different harmful conditions like poisonous substances, or if it's going to be some high intensity radiation or intake of certain harmful drugs, and then smoking habits or drinking habits of the mother were also found to be fairly or weakly associated with the development of this disorder. Besides, there are so many other normal causes like certain dietary habits recently identified also to have an association with the development of this disorder. One other major breakthrough was that certain regions of the brain, especially the prefrontal region, the premotor cortex and all that, and also the limbic system were all associated. The left hemisphere of the frontal lobes were mainly associated, their neural activities were associated with the development of the disorder if it was found to be slightly deviant from the other majority population. It was also found neurotransmitters like norepinephrine and dopamine, when their levels were found to be low, these kids had a risk of developing the attention deficit hyperactive disorder. Now, having spoken about the signs and symptoms, the assessment, the prevalence, and then we have also spoken about what are the causes that could be identified. So, when we see these kids who are going to behave a little socially awkward or impulsive or not so attentive, not able to complete tasks on time, let us not think it's just because they weren't nurtured well, they weren't tended well. It is also a part of their system deficits that they are made to function like that. Of course, when we talk about therapy, mainly it is pharmacological treatment which is advised for these kids, because it's only through stimulants, the drugs which are primarily stimulants are found to have high effective improvement in terms of the reduction of their non-conforming symptoms and signs. It is also found that motor responses of fidgeting and all that is found to fairly reduce with the help of these stimulants. Their attention span seems to increase with the help of these stimulants. Besides the stimulants, sometimes antidepressants and antipsychotics are also used to bring down their anxiety or other comorbid conditions that could be present. And it was also found that just starting with a pharmacological line of treatment for these kids and then going about with it will not yield long term results. And recent researchers have proved that a behavioral therapy or a behavioral technique module, when supplemented with the pharmacological treatment, was found to be quite effective over a longer period of time. And this behavioral therapy should involve the parents and the teachers who are associated with these kids. So, ideally, it goes such that the behavior therapist or the school counselor or the counseling psychologist sits along with these children who have been identified with ADHD, and they try actually establishing a rapport between the child, the parent, and the therapist, or the teacher and the therapist. And all together collaboratively they work on certain modules which are agreed on by the kid and the parent, or in other situations the kid and the teacher, based on what will be the positive reinforcements that will be given for the behavioral changes, certain social awkward behavioral patterns to be changed, what could be the reinforcements introduced for that, what will be their agreed on strategies of penalty or timeout that can be imposed if they were violating their social behavior norms and all that. Also, they could be given some training on how they could self reinforce themselves for some positive behavior changes, and how they could improve on their attention span by doing certain other physical activities like yoga or meditation, mindfulness, and so many other exercises. So, all of these will happen as a collaborative effort from the therapist and the parent or the teacher together, by helping the child to uh, self reinforce himself, become more aware of the inattention or the hyperactive signs that he or she has, and trying to reduce those symptoms to a optimum level. Of course, there has been found conclusive evidence on the fact that behavioral therapy, when done in collaboration with the family or the school setup, was found to have very positive outcomes for the child in reducing the symptoms and making the child more uh, easily adaptable to the different settings, as in the home, the family, or the social settings that he is involved, or also in their career settings in future years. Yeah. So this is all about attention deficit hyperactive disorder broadly. So I wish that in future, when we see children who are going to have certain deficits in their attention areas, or who are going to behave a little impulsively or so socially uncontrollably in different setups or settings, when we would rather appropriately perceive them and then try providing a space for them which will be more of security and care based. So thank you. I hope this video will be useful for you. Please share your valuable comments and feedback.